Again for another episode of Health Talks with Dr. Trinh. The one show, maybe the only show, that tries to make sense out of the noise and guide you to a healthier life. With our guide this morning, Dr. Trinh. Welcome, sir.
Good morning. Good morning. How are you?
I sometimes think you're a Sherpa. You're helping us climb the mountain. You're showing us the way here. You've been
Oh
to the
my.
top and you're trying to show us the fastest path to get there.
Yes. Are we sharing screen yet? I'm taking a look on the.
Let's do it
There
right
we
now.
are.
There we
Yes,
are.
we are.
Why am I sharing
Morning,
this?
guys.
Oh, I've
Oh,
got a
that's funny. The second screen is a screen of both of us.
yeah, that's a screen within a screen here. Let's try that again here.
How interesting. I've never seen that screen.
I never have seen that screen either here. I'm going to try and add a new one here while we're talking here, see if I can get a
Right.
different screen capture. That was like an endless screen there, a screen within a screen here. Oh, it's still showing the
I want
screen
to.
within the screen. I don't know why it's doing that. It's showing it from my camera.
How interesting. It's an endless screen, guys.
Endless screen. I may have to take me out here.
What do you call it? Kind of like that movie where you have a dream and it
Yeah.
goes deeper and the dream goes deeper to different levels. Inception. It's like the Inception movie
Yeah, I think so. It's just
of endless screens.
endless screens here. All right, I don't know why. We'll keep working on this, getting the screen right here this morning. I don't. It was working a while ago here. I don't know what's caused the strangeness here.
I like it. I like looking at my face twice on the two
That's
screens here.
endlessly it goes. It doesn't show my face here either. I don't know
Yeah,
what
it's
the
kind of like
problem.
the Matrix. That's right.
All right.
I wanted to update some of you guys on new stuff that we are learning about COVID
Mm-hmm.
and get a lot of folks just up to date on uh, on this potential second wave that is potential second wave
Yes.
that is potential second wave.
Yes.
Oh, I hear
Oh
myself
wow! Now
again.
I did something. What
Oh,
did I
I
do
hear
there?
myself
Wow!
again.
Now I did something. What did I do there?
It is the Matrix.
It is. I don't know what I'm doing now here. I had it all perfectly set up, and now it's acting strange on me here.
I like it. Okay.
We'll go back to
Well,
the first screen here.
as long as you guys can still hear me talk,
Yes, we'll do that. We're,
the the first thing we've learned in one of the latest studies that's been published is that immunity. We're learning something additional about immunity. The antibodies can last for in one study that I've seen, the antibodies can last 6 to 8 months. So in seeing that, that was fairly good news that our that you'll have at
there we go.
least half a year of immunity in one of the latest studies, which was pretty cool. Who's the blonde? Is there a blonde in that picture somewhere on our screen?
A
Sherry,
blonde. There shouldn't be. My
there should
wife,
be a
my
blonde.
wife will be wondering what's going on here if there's a blonde in the screen here.
Yeah, Sherry, are you like living in the Matrix, seeing something? But uh, but yeah, so immunity can last uh, at least 6 months, 6, 7 months on a recent study report. So I thought, oh, behaving like a blonde, says the blonde.
There we go. I think we finally got it all zoomed in. Or, I'm sorry, it took a while this morning here
Yeah,
because we were experimenting with my cameras and I was trying to show you and I got screwed up here. So
that's right. No worries. So so if the latest study is accurate, then then it's kind of neat that you have at least half a year of immunity after you've been infected. What we have seen is that the antibodies last longer if the severity of infection is more severe.
ah,
So if you're somebody who got the severe case of coronavirus and was super sick, apparently your antibodies will last much longer than
Do they last forever? Is it like the mumps? Once I get it, I'm never going to get sick again.
does not last forever. Does not
Okay.
last forever from what we've seen. And if your case was not severe, let's say you were one of those asymptomatic, right, and you didn't have any symptoms, and yet you were COVID positive, we've read that the antibodies, those antibodies, do not last as long. Um, and so it's most likely that with severe cases, the
Mm-hmm.
immune system is trying to gather a stronger response to fight the severity of it or the longevity of how long you've been sick. So it's probably related as to why your body builds up more antibodies than somebody who had an asymptomatic case and you didn't have any symptoms, and although you were COVID positive,
Right.
uh, and you recovered really quick. So it probably means that your body did not need to create a lot of antibodies for mild cases, and
Ah.
as a result of that, those antibodies went away quickly. Is That's kind of my interpretation of that. But in the latest study, it does those antibodies did last, probably up to about 6 months is what I was seeing, and 5 to 7 months I think was something like that. But half a year. Um, if that's the case, though, there. If that's the case, I wonder if you can get infected again like the following year, right?
Yeah.
If you're is then it would be kind of like the flu,
Yeah. Right. You get
where
it
you
every
can
year.
catch the flu one year and the next year you can catch the flu again because those antibodies don't last forever, right? Your flu antibodies don't last forever. Good morning, Cindy. And so it's still evolving, guys, but we are learning that these antibodies in the latest study will last about maybe half a year. Um, but if you have a really mild case of it, those antibodies may not last as long. And and so that's probably what we're seeing as in the field of antibody studies and vaccine studies. Good morning, Sonia. The Now the question is, though, if that's the case and your antibodies don't last forever, like the measles and the mumps and rubella, right, where those antibodies will last for years and years and years, does that mean you need to be vaccinated on a regular basis, right? And or how long does the vaccine work, right? For example, the vaccine for the flu is only once a year. The vaccine for tetanus is once every 10 years. The vaccine for hepatitis uh, B or hepatitis C. We don't have a vaccine for hepatitis C. We have a vaccine for hepatitis A, right? A and B will last much longer. So, how long do these vaccines, or how long will the coronavirus vaccine last? Is a good question. Once the vaccine comes out, is it something that you need every year, or is it something you get one shot and is good for a long time? Uh, so those are all things to be figured out, and will be very interesting. Good morning, Letty. And so that's where we're at in learning about your immune system and how long the antibodies in your body will last after you've been infected. And so far, it's been up to 5 to 7 months, I think, in one study that I've seen. So about half a year, um, which is, I guess, kind of like the flu, where your antibodies will last for a good number of months, and then next year you're susceptible to the flu again, if that's the case.
Do you ever get less susceptible? I mean, do I get the flu every year, and do I ever build up an immunity to it, or is it just builds up for a while and goes away, flushes out of your system? And how does it? Why does some stick with you for life and some flush out in a few weeks or a few months?
It's a good question. It's a good question. The longevity of these, right, of immunity. Antibodies isn't the only thing that provides immunity. There's other immunity, T cell immunity, where your other cells uh, will remember the uh, the virus or the bacteria. Antibody is just one type of immunity that can be built. Um, so it's a little bit more complex than just looking at antibodies, actually. So it's a variety of things. Um, so the other thing I want to talk to you guys about is viral load. Super important that you guys understand about viral load. How many of you guys here have heard or know what this means? The viral load. The and it could be a viral load for for coronavirus. It could be a viral load for HIV. We check HIV viral loads all the time in patients who have HIV. It can be viral load for any viruses. Hepatitis C, we check viral loads all the time when we're treating a patient with hepatitis C to make sure that the viral load is going down. Um, do you guys know what viral load means? On there, type yes or no on Facebook.
I
If,
don't know. I know people talk about this all the time, but I don't know.
mhm. So, do you guys know what viral load means? So, viral load is simply the quantity or the amount of viruses that is in your blood that can be measured, right? The amount of virus that can be measured in your blood. We call that the viral load, right? The load of virus
Now,
in.
you say that, and I still don't understand the amount of. So, if I've got the virus, only so much of it can be measured, or how much? You
We can
still lost
measure
me.
how much virus you have.
Oh, how much I have. So, if I got a little bit or a lot, okay.
Yes, yes, yes. It's called viral load. I'm gonna type it out here. Is the amount is the number of viruses, right? The number of viruses that is measurable in your blood.
So, do we get? I guess I never thought about that. It's like a bad case of the flu or a mild case of the flu. Do I get a lot of? Is there a lot of virus swimming in my body, or just a little bit?
That's right. A lot of virus versus a little bit, right? The viral load. Why is this important?
I
It's
have no
important
idea.
because we are able to link the severity of your coronavirus illness to your viral load. So for those who have a high viral load, meaning they have, and it's measurable, right? We can measure it in the blood. For those who have a high quantity, a high number of virus particles in your blood, typically your disease process, your infectious process is more severe than those who have a low number of viruses in your blood. That's something that we can measure. Does that make sense to you guys?
So I guess sort of. You're saying that you're not just measuring whether I got it, but how badly I got it. How much is in my body.
That's right. The quantity of virus
All
that's
right,
in.
so then the question comes up, what determines the quantity of virus? Is it how close I was in contact, how much I was in contact, or is my body just everybody's body is different? And some people, you pass me by and I get a bad case, and some people, you cough in my face and nothing happens.
That's right. So the viral load is determined by two factors. The first factor is how exposed you are and how frequently exposed you are to the virus, right? And and so the second factor is how fast the virus uh, divides, and it's based on your immunity and how strong your immune system is, right? How
Ah,
strong your immune system is.
right.
Now, how strong, now both of those factors can actually be controlled by you, right? If you if you want a strong immune system, there are ways to improve your immune system through lifestyle, through diet, right? Through eating certain foods that help with your immune system and avoiding certain foods that damage your immune system or weakens your immune system.
Okay.
Right?
How about things like I'll stop you for a second. How about things like vitamins? My wife is such a believer, and I think it's a waste of time. I think vitamins are a charlatan. This is I'm not a doctor. Act like we know, but I just think they get flushed right out of your system. I don't think that your body has a chance to absorb them in the same way that they do when they eat them naturally in fruit or vegetables or something. But
Well,
my wife always thinks, well, it can't hurt, so she's always taking multivitamins.
yes, yes. Which is why she'll probably be living longer than you will, Paul. I'm
So
just kidding. I'm just kidding, right?
thanks.
So vitamins. There's two types of vitamins. There are vitamins that are water soluble, and
Okay.
then there are vitamins that are fat soluble.
Hmm.
The water soluble vitamins, your body will use what it has in store now, and anything that is in excess of what it needs, you pee it out, right? The fat soluble vitamins is actually stored. It's stored.
Ah.
And so
I have
so your
never
body
heard this before. I've had this debate round and round with my doctor and everybody else's, and everybody's like, "Hey, it can't hurt." And I'm like, "But can it? Does it really help?" So
so your
you give me two different kinds. All right.
yeah, so your fat soluble vitamins can be stored for later use. The water soluble vitamins, if you don't need it now, you'll pee it out. I believe that in the United States, we probably have the most expensive pee in the world.
Yeah.
Now,
Yeah.
now, having said that, I am a proponent of vitamins, especially if your nutrition is not good.
Okay.
If if you have good nutrition and you eat a balanced meal and you eat healthy meals, then really, your food should be your medicine,
Right.
right? You don't need to take extra pills and all those different things, right?
But we're a pill popping society. We just give me a simple pill to get rid of every problem.
We are a pill popping society. Yeah.
In fact, here's my little. I was going to take it this morning. I don't know if you can even see it. Let's hold it up
You see,
really close. There's my little multivitamin from CVS
really?
here. My wife makes me take it every morning here. My little
Oh,
multivitamin from CVS here.
oh, I like that.
Give
I
a
like
shout
that.
out
What?
to CVS. It's just their generic multivitamin.
I see. I see.
That's
This is what I do
magic.
in the
That's
morning.
magic right there, boy. I don't need anything else. That's all I can eat
All
all
you
sorts.
need.
I
Yeah,
can eat anything crappy I want because I take
you
that
can go
pill.
and have your burger and
That's
fries as
right.
long as you pop your pill, right?
As I pop my pill, I'm good.
So this is my breakfast. I do like 32 ounces of water every morning,
Wow.
and so I'm almost done with my 32 ounce. I should like finish my 32 ounce
Well, I do.
before
I have something similar, but I just started on mine today here, so I've got a lot to go here. We'll all take a slug. Everybody take a slug of water this morning with Dr. Trin.
What do you
For,
got in there? Whiskey or rum?
well, I'm Irish. It's got to be whiskey. We don't drink rum.
Hmm. I love it. We should like put everyone on Zoom and then we all take our slug of.
A slug of something.
Now, if we were doing this chat at 5 p.m., then it may be happy hour.
Yeah.
In which case, we can drink something a little different.
Then we could have an
Like
adult. We could have a,
adult. Uh-huh.
you wouldn't know this, but I'm very Irish, and so I'm very into Irish culture and everything here. And if I do have a little drop of something, as my grandmother would say, it might be a little, just for me cough. I don't do it for any other reason, but just for me cough, she used to say. And so, if you'd have whiskey, whiskey is an English corruption of a phrase in Gaelic, in
Uh-huh.
Irish, that basically says the breath of life, whiskahei or something like that. The breath of life. So the Irish originally thought their whiskey wasn't just something to make them feel good or happy.
Right.
It was the breath of life.
Nice. So, where are we at? Viral load.
Viral load.
So, so viral load, right, which is the amount of virus that's in your body, and it's measurable through a blood test to look at, how much virus you have, how much COVID virus you have in your blood test. Again, is tied to the severity. of how sick you are. If you have a high viral load, chances are, you're going to be super sick, right? It's going to be a more severe,
But the
and it
good,
makes sense because
but
you get
the
more viruses attacking you,
but the
right?
good news is, if you survive that super sickness, you're going to have a
More
super more
antibodies.
antibodies, right?
You have more antibodies, right? Now, here's the thing, though. Having a good immune system is one part of what the viral load may look like.
Mm-hmm.
Meaning, if your immune system is good, it will attack the virus. It will, at the start, and hopefully lower that viral load. The second component of what controls viral load is exposure
Hmm.
to the virus, right? Exposure
And is
to the
that
virus.
let's break that down. Exposure. Does that mean I'm exposed multiple times, or in a close encounter as opposed to a far encounter? Somebody coughed right on me,
Both. The
or
answer is both. Yes.
okay,
Multiple times, frequency of exposure, and how close you are to someone who's sick. So let's say if you and I were like, you know, like let's say I need some props here.
yeah, I'm
So
right next to you. I'm right behind you. Right,
yeah. So if we were like 2 feet apart and
right,
you cough at me
right,
and I did not have a mask, so your entire cough is going here.
right,
So that's a lot of viral load exposure, right?
right.
Exposure to the quantity of virus. An unexposed, an unprotected person without a mask is more exposed to a higher quantity of virus from somebody coughing at them who's sick.
And if I kept coughing, if we were together for an hour or a half hour, the longer I'm coughing on you, the longer I'm loading you up.
The longer you're loading me up with virus. This is why I think in Italy they did some research and they realized that the population who's most infected
Mhm.
with coronavirus were actually people who worked in the hospital, medical staff,
Yeah,
doctors and nurses,
makes
right?
sense, right?
I think it was like 12% or something like that. It's over 10% of
Wow,
doctors and nurses who work in the hospitals in Italy because they had their big, outbreak earlier this year.
right.
About 10 to 12% of them got sick and got infected with it. And that's due to frequent exposure to coronavirus, right? The frequency of how often you were exposed to coronavirus is,
Now
you
that
know,
matches my own anecdotal evidence. I only know one person in my small circle of the world that has contracted COVID, and it's sister's, my sister-in-law's son's partner, if that makes sense. His partner is a emergency room doctor,
right.
and so he
Mhm.
uh, was exposed a lot,
Frequent exposure.
frequent
This,
exposure and close exposure. And
right.
when he got sick, he got really sick to the point he had to, they put him on what do you call a
Ventilator,
ventilator, and they put
yeah,
him,
ICU,
knocked him
whatever.
out, and put him on a ventilator.
Yeah.
And he's one of those scary ones you hear about that he hasn't come back. I mean, he
Right.
lived, but he's foggy, he's
Brain fog.
brain fog, tired, all this
Yeah.
stuff.
We should talk about that sometime. What happens after COVID, right? These long-term symptoms.
Yeah.
Uh, but so this is also why people who live in the same family, in the same household, is one of the most frequent ways where you catch coronavirus is you catch it from your own family member.
Yeah.
It's because of that frequency of exposure, right? How frequent you were exposed to it. It increases the viral load exposure, right? Frequency of exposure increases your viral load exposure.
Right.
So it's all about viral load, right? Now, here's another thing. It's frequency of exposure, but it's also the quantity of exposure. How much, like if somebody were to cough you right in your face, that quantity of exposure is high if they were 2 feet from you versus if they were 6 feet from you and they coughed at you. The quantity of viral load is less because as the virus is flying toward you, it is disperses, right? So you get less of that virus 6 feet away versus 2 feet away,
Hmm.
right?
So
That's
that's
why
why
the
you want
closer.
us, and that. So is this why you're always telling us, all you guys, stand back and put up some little shield? So the further away you are, the less of it hits you, and the more you got a shield. That's another way to prevent some of it from hitting me and getting loaded up.
That's right. You want a low viral load. If you are exposed to somebody, even if you ever get any COVID, you want that low viral load, not high, right?
Right.
So here's what this does, right? Here's what this does. If I am sick with coronavirus, right, and I wear this, what am I doing to the viral load now
You're
when I
lowering
wear
it.
a mask?
This is so simple. Come on, why are we all fighting it? So we're just we're it's a magic shield. You're cutting down the amount of virus you can contract.
I'm cutting down the viral load coming out because most of it's going to be caught in my mask.
And
Make sense?
is it in or out? There's always a debate. Are you just protecting me by wearing the mask, or am I protecting myself from it flying through the air and getting into my lungs here?
Well, if we were both wearing a mask, right?
Right.
If I had COVID and I was infected
Okay.
and we were both wearing a mask and I cough, right? So I'll pretend to cough,
Oh,
right? And
and I saw that. It flew right past me. I could see it. It
that's
flew
right.
right past
So,
me.
so let's take your mask off.
Right.
If we were 2 feet apart and I was like, all this virus is going to your face,
Right.
that's a high viral load. The quantity of virus is really high because I'm not protected and you're not protected, right? Now, if I was the only one wearing the mask and you were not wearing the mask and I was coughing and I was sick with coronavirus and I was like, right? So most of it's going to be caught here because the virus is in the little droplets, right? The little cough droplets.
Right.
So most of it is going to be caught here. There'll be probably a little bit of virus that comes out and you'll be exposed to it, won't you?
Yeah.
So I'm cutting down my viral load, right? That's coming out.
You're being
I'm cutting
considerate
down,
of others. You're shooting less of it into the air.
shooting less of it and when I wear a mask.
Right.
So I'm cutting down that viral load, but you're not wearing a mask, are you? So you're getting some of it,
I'm not wearing any stinking masks. Masks don't work.
right? You're wearing some of it. I mean, you're getting some virus,
All
right?
right.
But go ahead and put your mask on now,
Okay.
okay? Because the virus enters your body through your nose and your mouth and a little bit through your eyes, right?
Mhm.
So now I'm coughing. 90% of it is stuck here. 10% of it is going out, right? I'm just giving a number.
Yeah.
I'm not saying that's exact, right? So if 90% of it is stuck here and 10% of it is going out, that 10% that's going out and you're wearing your mask, right? That 10% is bouncing most likely off your mask now or getting caught there,
Bing,
right?
bing,
And getting caught there. This is how we protect each other from the virus. We're cutting down the viral load that you're exposed to when we wear a mask.
So let's
Right.
go. Let's back up a second now here. Then why wasn't this explained as simply as you did from the beginning? Why did Dr. Fauci, great guy, why did he and others tell us you don't have to wear a mask in the beginning? And they now say it was just because we didn't want anybody running and buying a mask because we didn't have enough of them. So we didn't want to create a panic and a flood on the market. There was already a lack of toilet paper. We didn't want a lack of masks on top of it. Why didn't they
Uh,
explain this that simply from top down? We'll forget about the politicians, just the health professionals. Why did they, in the beginning, not tell us the same story?
Probably because I'm a better explainer.
That's probably it. See, it was so obvious. If Dr. Trinh had been in charge of this, none of this would have happened. We all would have thrown our masks up. No, it really is, because you've even said on this forum before, others have said, how do you feel about wearing masks in the beginning? And many of your people said, well, I don't know. I don't know if it really works or not. There's a conflicting message about wearing a mask. And even to this day, there are those, because I'm sorry to say, one side staked out, masks don't work, we don't need them, we don't need shutdowns, we don't need any of this stuff. And the other side is saying, no, listen to the science, we need masks, we need some shutdowns, we need all these things. And in between is the population going, I don't want to wear a mask, I don't want to shut down, I don't know who to listen to.
It's all about viral load. and how exposed you are, how the quantity of viruses that are as coming at your face, and it's all about protecting us and minimizing that viral load,
Yeah.
which is why, which is why this cuts down on the viral load coming out, because if you were cough or talk, most of it goes in here, right? The little microscopic, spit particle or saliva gets caught in here. So
Now I'm going to open up. We got.
yeah,
Does anybody have any questions about that? Is it clear to anybody? Anybody? Not. It's so simple to grasp. I don't know why nobody has talked about this viral load. Let's cut down how much you're shooting out. Let's cut down how much you're taking in. Let's. If we got two masks, we got two ways to block it here, going out and coming in. Why is this still so darn controversial?
I I think it's been less controversial now. Now that I think there's a general. I mean, I walk around Huntington Beach now, and I'm glad to say that compared to maybe 3 4 months ago, I'm glad to say that there's most people are wearing a mask.
And I
Uh,
see the same thing. In the beginning, Huntington Beach was a perfect example, where like they opened it on Memorial Day back up again, and nobody was wearing a mask. And we were talking about, I'd go to Target someplace. I live in South County, and half the people weren't wearing masks. I do see the same thing. I do see much more adherence, much more acceptance. I think it's much more common. People are thinking about it and complying much greater than they were. But there's still, all right, so let's go to the other extreme. There was a paper, I forgot the name of it now here. People can look it up on the internet, but there was a group of supposed scientists that signed a document, which is now floating around, I'm sorry to say, right-wing media, various outlets. I saw it on OWN the other night, One America News, which I flicked around to. And they're saying this is the death rate has gone down dramatically,
mhm.
as evidenced by all the people in Washington who got it at the super spreader event from the president on down. It is not as deadly as we once thought it was, and therefore just get it and get over it. Literally, we should have parties like they did when I was a kid. When I was a kid and a kid got measles or mumps,
Mhm.
the parents brought all the kids together and said, let's just get it over with. And so, because they're not going to die, and once they get sick, they're all, let's not drag this out forever here. There are people suggesting, literally, that we should all put down our masks and literally infect each other and just get it over with and get some sort of herd immunity. Let's all build up some antibodies here, except those who are in risk. You wear a mask, you stay at home, you stay isolated, but the rest of us, the young and the healthy, get sick and get it over with.
So there's two things about herd immunity. Herd immunity makes the assumption that once you catch the virus and you build an immune system to it,
Hmm.
that immune system will last forever,
Right. Like the
right? That's an
mumps.
assumption,
Right.
like the mumps, right? But but think of it this way: we don't know if your immune system is going to remember this virus forever. It's like the flu, right? Can you get herd immunity to the flu?
No.
No, you can't, because you can get the flu again the next year,
Right.
and you can get the flu again the following year. There's no herd immunity with the flu,
That's a good point.
right? I mean, which is why we do vaccinations for the flu. There's no such thing as herd immunity for many. There's no herd immunity against the common cold.
Mm-mm.
You catch a common cold, and you can,
And sometimes you can get it two or three. It doesn't happen often, but I've had a cold, and then 3 months later I get it again. I think, how did that happen?
because the virus changes and mutates, right?
Right.
So there's this assumption that you can get herd immunity to COVID, but we actually don't know how long your immune system's going to remember it. I mean, the latest study shows that your immune system remembers it for 5 to 7 months, which is only half a year. What that means is that herd immunity theory goes out the window, because you can get it again next year,
Yeah.
right?
And the problem I always have with the herd immunity idea is it assumes that those who are at risk, who are older, who have a compromised immune system or a weakened immune system because of their age or some pre-existing condition, that they, one, all know it, and two, will all stay away and just isolate themselves so that the other 80, 90% of the world can go about their life and get sick and get it over with, that they themselves will separate themselves, and or that those young people who go get it, you're not going to be that sick, just get it over with and get your immunity and go on with your life, that they themselves are going to stay away from other people. So I might still be wearing a mask, but my daughter says, hey, I'm young, I'm going to go get sick, and so it's up to you to stay away, Dad. I may still see you because I'm going to drop off my kid and your grandson and everything here. It's a fairy tale that somehow the infected and the
Don't
vulnerable,
commingle.
yeah, don't
Yeah,
commingle.
that they don't commingle.
Right.
Yeah, that's almost impossible. So what herd immunity, if it works, will do is that it will take out those who are weak, and it's herd immunity is based on survival of the fittest,
Yeah. Right.
right? The survival of the herd.
And
So
there's
what?
some suggesting, as cruel as that sounds, that maybe that's just the way this should be, that there's too many old people in the nursing homes anyway, and too many weak, old, sick people. And if they can't protect themselves, tough luck, Charlie. We can't afford to shut down the world to protect the few.
Yeah, I think.
That's a harsh statement, but there are people that are kind of going that way. Maybe I'm overstating it, but they're kind of saying,
Yeah,
hey, c'est la vie, such is life. It has risk to it. You drive a car every day. You know you're going to that there's a risk you're going to get in a car accident. It's just part of living that you run this gauntlet of
I
diseases and
I
challenges.
I totally understand. Yeah, I totally understand that that we cannot shut down, and businesses need to function. People need to go to work. What is worse, the fear of coronavirus or having an empty bank account,
Yeah, right.
right?
and,
So I
and there's a reality to both. So that's why I wonder from the beginning. I think this is just me. I'm going to get on my little soapbox for 2 minutes here. I think part of the problem is look at when the next one comes. Forget about looking backwards. When the next one comes, and there will be another one. This is what nobody wants to accept. This is not. This is the new norm. There are going to be dangerous bugs floating around in the air until I don't know, whenever. I don't know what causes all these things, whether it's the wet markets in Asia or whether it's just the interconnected world and stuff spreads so fast, or however these things are springing up and jumping from animals to humans with
I
more frequency.
I know what
Ebola.
the final bug's gonna be.
What's the final bug?
The zombie apocalypse.
Well, I think, or there it is. I have a spider right up here. It's looking for me here.
Zombie apocalypse will be the final bug.
As crazy as that sounds, that's kind of not that far off. All right, but so let's just take this ugly fact on the table. There probably are more bugs coming. Maybe not this year, maybe next year, maybe in 10 years, but this isn't the last pandemic. So here's my point. There were countries where it hit, and they quickly identified who had it through massive testing, and they quickly traced back who they had been around and they quickly isolated it and jumped on it quickly and contained it so it did not get out. And somebody said the other day, the only reason you need to shut down a society is because you were admitting you didn't catch it in the beginning, and it's now, we don't know where it is. Could be everywhere. So the fact a shutdown isn't the first response,
Mhm.
it's a failure to address it quickly and isolate it and contain it in the beginning. What do you think of that?
Mm.
Like they say for example, Taiwan supposedly has done a great job of isolating, contain. They've had something
Yeah,
ridiculous, 7 deaths or
yeah,
70 deaths or something. Yeah,
yeah. Same thing with like Hong Kong
right,
and so these southeast countries that have very low numbers, they they lived through SARS.
yes,
They lived through SARS and they have learned from it.
right,
And so now with the next, it's like a trigger reaction. It's like, okay, virus is here, your mask is on,
Yeah.
we're all protected. We test everybody. We catch it early, and we do,
And it's the
contact.
fact that we dilly dallied. Is it real? Is it there? Is it going to spread? Is it didn't? And we didn't have the systems in place to get out the tests quickly, rapidly,
Yeah.
like we are doing now. More and more tests are available. For a long time, it was hard to get a test. They were controlled. They were limited in number. It took a long time to get a result back. All of these things that allowed the bug to just start spreading.
Yeah, we didn't live through SARS, so I guarantee you the next pandemic that's here, that's not COVID, right? Whatever this next pandemic is, we will be more aware and be probably more ready. Hopefully,
I
I'm
think we will.
hoping that we'll learn from this pandemic, right?
Right.
Of what we need to do. So
But it's
so
only once it spreads when you throw up your hands and say, then we got no choice. Everybody stay home because I don't know who's got it. We've got so many people out there that we got to somehow contain this and get a handle on it. So everybody shut down. Everybody stay home. Had they been able to test, and I know this sounds ridiculous, but I think we will be better. Had they been able to have millions of tests out quickly and quickly isolate and trace people, if we had enough healthcare workers to go out and call you up and say, who did you talk to? And then go talk to those people and isolate them quickly. We could have contained this, and hopefully we will contain the next one much better than with this one, because we can't keep going through shutting the country down, spending trillions of dollars to support people while they're shut down, and then letting it just linger on and burn out.
yeah, yeah, definitely this will be a good learning lesson for the next pandemic. um, and uh, and so yeah, it's a huge economic disaster to close the country.
Yeah.
Definitely right,
So
man.
does your audience accept that? Does that make sense to people? Will there be another pandemic? And will we react any differently? Or are we just going to bury our heads in the sand and we're stuck in these tribal responses now here that we're not going to act any different in the future? What do you think out there, guys? Are we going to be better prepared? Have we learned anything? And are we prepared for another one? I don't know. Is this a year away? Is this every 10 years? Is this every 2 years now? I don't know.
Yeah, it's just a matter of, it's not a matter of is another one coming, it's just a matter of when the
Yeah.
next pandemic
And
is
nobody's
coming.
talking about that. We all act like, let's get through this one and then whew,
Yeah,
never
yeah,
happen
we got to
again.
get through this one first. We're still in the midst of it. And so
So what do you
yes,
think, your audience? Anybody think there's more pandemics coming and we're going to be any better prepared? I'd love to see some
I'm
responses.
prepared for the zombie apocalypse.
How would you be prepared for a zombie apocalypse?
Oh, I got tons of weapons. You got to go for the head. You got to go for the head. Zombie apocalypse.
But it's funny, but you say that because, and I know you're kidding, but I hope you're kidding. Movies reflect the paranoia of the time. I grew up in the 50s and 60s, and the movies were all about Red Scare. The commies are coming. And if it wasn't the Reds, it was aliens were coming to take over the world. And all of a sudden, that disappeared for a long period of time. In the 70s and 80s, there weren't those apocalyptic movies. And then all of a sudden, in the last few years, prior to COVID, we started seeing these zombie movies, Walking Dead, and other stuff that you love. And all of that tells me that we're afraid again. We're afraid of things we can't control. We're afraid that something's coming to get us.
I recommend a wilderness survival course for every American. How to build your own shelter, how to create your own fire.
You're laughing, but there are people that believe. They call them preppers, and there's a whole subculture of people who are stocking up again, just like we did in the 60s, because we thought the bomb was going to drop any minute, and we put food in the basement, and we built shelters. I knew people that built, we didn't, but I knew people that built shelters and stuff, and that took survival courses, and why so many people are armed. Hey, when the zombie apocalypse comes, I better have literally some weapons in the house to.
You can drop by my home and you'll be protected.
Do you really have guns in the house? Do you have weapons in the house? Seriously, do you have guns in the house?
I
You're not going
can't
to
say.
tell. You can't say. I don't own a gun. I've never.
I'm
You
just
can
kidding.
come to my house. I don't own a gun
Well,
here.
I was a Marine, so
Were you?
I
Oh, I didn't know
yeah,
that.
yeah, I've had guns as a Marine, since age 18. So
So you're
so yeah,
familiar, trained in the use of. I'd shoot
I'm
myself.
trained in the use of it.
I
I'm
wouldn't know
trained
what
in
to
the use
do
of
with a
it.
gun. I'd shoot
Yeah,
myself.
yes, yes. So I think it's really important to be prepared, not necessarily for the zombie apocalypse, but just be prepared in general. I mean, you never know when the big earthquake's going to come, right?
Yeah.
Do you have food? Do you have water at home stocked up
Oh,
in
that's a whole
case,
nother discussion. I
in
keep
case
thinking I
you're
should, and
right?
I'm
Yeah.
gonna, but no, I have a little bit of water, and I think about it for 5 minutes, and then I put it
Right.
off. That's not
Yeah.
good. That's some
I
other
mean, the
day.
beer is just going to last for so long in the fridge until,
Well, whiskey lasts a long time.
whiskey lasts a little longer. So make sure you get your chlorine tablets or iodine tablets. We should do
Yeah,
we should do a session, guys, on what items you need to prepare
that would be fabulous.
in case everything shuts down or in case the big earthquake hits or the zombie apocalypse is here. We should talk about what items are
We
needed
had somebody, I'll see if I can find them. We had somebody on a year or two ago on one of our shows, and they sell kits. That was their business. And it was little barrels and drums they would sell you for a couple $100, and it would have all the kind of stuff that you need. And it was stuff that you didn't think about, like things to fix the water supply. The water breaks. Let's
right.
say there's an earthquake tomorrow. Oh, this is, we could go down this path forever. Let's say there's an earthquake tomorrow. We know that we live in an earthquake zone. Sooner or later, there will be a big earthquake. Hopefully, it won't be as big or bad or as focused as we think it will be, but it's
Yeah.
coming. It's inevitable. We all know it. And in that earthquake, the long trenches we've built to bring the water from Colorado or from up north, these aqueducts where we
Okay.
get all
Good.
our water because we don't have any water in the ground, a little bit in North County, but not any in South County, those will break. So they're already talking about storage facilities and other things. But in the meantime, you may have to drink your toilet water because it's drinkable. You may have to do other things or boil the water if it's
I
not.
mean, look at Bear Grill. I mean, he drank his own pee. He survived on
Yeah,
TV. He
yeah,
survived, right?
exactly.
Okay, let's do it next week. I want to do a session next week
Okay, prepping.
on prepping, like what you need, like what do you need to do to clean your water
Yeah.
or to filter your water? How do you make a fire? What are do you need a knife or how do you make,
I'll give you another one. You should have a tool. My wife the other day, we had something break. Not the other day. This was a couple months ago, but we had a water leak in our house, a pretty big one, and she came home and didn't know how to turn the water off. Now we've talked about this before, but she didn't remember it. She didn't know where the shut-off valve was in the front of the house. And we have a little tool that I bought at Home Depot that I keep right outside the garage, in the garage door.
Yeah.
And it allows you to turn that little thing from, if it's flowing with the pipe or you want to shut it off for the gas and for the water both. And we went through that again. I said, okay, good example. So here's another thing. That's why we have this tool.
Right,
Because suddenly, not only where is it, how do I turn it off? The gas is leaking. The water's leaking.
right. So that's going to be a good session for prepping.
Okay.
And yeah, and I can bring stuff next week, show and tell,
Okay.
the items you need, and maybe the items you need to clean your water or filter dirty water if you have to drink from your toilet water or whatever, right? Or if you're stuck out in the woods somewhere and you had to drink from a river. Um, and so let's do prepping next week since this is we're heading into the winter,
Yeah.
right? COVID is coming back. Who knows if things will shut down or not shut down? We all got to be prepared.
So many things. Do you have just a basic emergency kit for you cut yourself? Maybe you can't go to the hospital.
Yeah.
Maybe the roads are broken up, and maybe everything's down. Do you have a ladder to get out of your house because you're out of the second story window? I mean, there's lots, and you can go down a lot of little basic things to just be prepared and don't just have them, know where they're at. We've had this tool for years. My wife forgot where the tool was and forgot where the shutoff is. It's almost like we need to do home drills once a year just to remind everybody.
Mm-hmm. So yeah, that'll be good. Let's
Well,
I'll be
you're prepping us for the worst because you do. Last question of the day here. Do you think a second wave is coming, and is it here? The coronavirus. Are we in the feared fall? Is this the start? We're seeing
I
the
think,
numbers go up again.
yes, I think the second wave is here. And if you look at the number of cases in like over 20 plus states that we have right now, 20, 30 states, they're all climbing.
Yeah.
The fear I have is the flu is here and nobody's going to know who's got what,
Yes.
right? Do you have the flu? Do you have COVID? And so it's going to be so it's important, guys, to decrease your viral load,
Yes. That's the
right? Cut
lesson
down the
today.
viral load. And I gave you an explanation of the viral load because the viral load determines the severity of your infection. Is it going to be are you going to be hospitalized or not hospitalized? You know, those who are hospitalized have high viral loads
Right.
compared to those who are not
And
hospitalized.
we have
Yeah,
control over the viral load. We don't have control. If we have control over our immune system, but that's over time.
yeah,
Today, if my immune system is weakened, either because of something I've done or a condition I have or my age or whatever, maybe there's not much I can do to fix that in the next 30 days or 60 days. I can work on it. Don't
right.
give up. But I can, so I may not be able to change my immune system overnight, but tomorrow I can reduce the viral load I might get.
You can reduce your viral load. And now that you guys know what viral load means.
All right. My dad always said, don't be loaded. So, don't live life loaded. So, right.
Yes, yes. So super important.
Okay. All right. Thank you so much. Well, next week, prepping.
Prepping next week, guys. Prepping next week.
You've been listening to another great example of Health Talks with Dr. Trinh right here in Orange County's only community radio station, octalkradio.net.
This is CB.